pass the floor over now to Stephanie, who will describe her practice in Newfoundland.
Oh, thank you, Phil. I am so excited to be here today to chat with you about the healthcare hub model. I believe that we can look at this model through a few different lenses. So first of all, we can look at it from a pharmacy business perspective. So moving from a product-based business to a service-based business. We can also look at it through the lens of contribution. So pharmacists and pharmacies' contribution to the greater healthcare system. And we can also look at it through the lens of professional satisfaction, which is really what I want to talk about here today. Because the truth is that 7 years ago, I was actively looking for a different career. And it's incredible that through this healthcare hub model, I've been able to move from a pharmacist who felt like they weren't making an impact on a day-to-day basis to being named the 2021 Canadian Pharmacist of the Year. So this is a model that I truly believe in. If you are a pharmacist who is tired right now of the way that you are practicing, or if you are a pharmacy owner and you're down in the trenches and you can't see the forest for the trees, then this presentation is absolutely for you, because I want to show you today that you have all of the tools that you need to start creating your own healthcare hub. So let's get started. I think in order to know where we're going, we have to realize where we came from. And so when I graduated from pharmacy school 13 years ago, I strongly believed that I would be part of the circle of care, that we would be a cog in the wheel, so to speak, that we would be getting calls from physicians and healthcare providers on a daily basis looking for recommendations. And once I got out in the real world and started working in community pharmacy, I realized it wasn't really like that. Community pharmacy was actually the end of the line. And so what I discovered was that we really only had opportunities to speak with other healthcare providers when we identified a red flag. So in 2016, I wrote this business plan and I dug it out for you because in this business plan, I described my ideal practice as a healthcare hub. And this is a visual representation of what I believe the healthcare hub to be. And at its core, what it is the pharmacy and the pharmacist is the connector for the healthcare system. We help to close up the gaps, and using our toolbox, we could be invaluable and dependable to our fellow healthcare providers and to our patients. And the tools are really just one part of the equation. The conversations and the connections that we make are really what brings this model to life. So from that business plan came this pharmacy. So welcome to Complete Care Pharmacy in Rocky Harbor, Newfoundland. I wanted to create a place that people felt comfortable coming into. It was inviting. People felt confident when they came in, and they really wanted to have the opportunity to speak with the pharmacist. You'll see that our pharmacy doesn't have any product in front of it, and that's because I wanted to convey to patients that this was a professional clinical area, separate really from the sales floor. What I've discovered as I look at it today is really what we created was a primary care facility. So we offer primary care and health promotion. And growth of our business came through word of mouth and the patient experience. I think it's important to note here that we don't do anything astronomical at this pharmacy. We are doing and offering a lot of the same services that you're probably already offering or that you have the ability to offer, like blood pressure checks and medication reviews. We just do the ordinary things, but we do them extraordinarily well. And we expand what a patient expects when they come to the pharmacy. So let's talk about those patients who walk up to your counter, because every patient is an opportunity. And what we do well and what we do differently is that we don't just offer services. We don't just have a menu board of services that you can avail of at our pharmacy. We actually connect patients to services through our conversations. So we don't wait for a patient to come in with a bag stuffer and tell us that they want blister packs. We instead have conversations with our patients. We identify patients who may be struggling with their medications, and then we offer them the solution of blister packs. We read between the lines when a patient maybe doesn't feel well, and we pull them in and maybe do a blood pressure check or a blood sugar check and help them learn what those numbers mean. We have conversations with every patient, and then we open our toolbox to see how we can best serve those patients. So let's talk about that toolbox, because this is what I believe that most pharmacists would think of when they think of their toolbox. And this is a great place to start, but I want you to start thinking bigger than you have before. If you're going to fill in the gaps, if you're going to be a clinician, then you need more tools. And this is what my practice looks like. Now, we're not just a dispensary. We're a primary care provider. I focus on health promotion and patient education, and I fill in the gaps for providers. So I can give a physician a weekly blood pressure check for a patient that they're titrating on antihypertensives. I can make an informed decision about a minor ailments prescription using the labs that I have access to, and I can validate an indication using clinical reports. You have all of these tools at your disposal to start creating your own healthcare hub. It may take a little bit of investment from a business perspective, but it's mostly about rethinking your practice as a clinician. Are there going to be challenges? Absolutely, there are challenges. If there weren't challenges, it wouldn't be as rewarding. And for us, one of our challenges is our rural geography. We're located in Newfoundland, but we service patients up to 90 kilometers away from the pharmacy. We offer a daily delivery. And so while that's a challenge, it also sparked creativity, because no matter how inviting our pharmacy is, we're not going to get every single patient in for a blood pressure check, which got me thinking, well, how can I give all of my patients the same education and experience if they don't walk in through my doors? And that's really what sparked my social media. I am a patient educator at heart. That is my core skill, and that is what has helped to build this business. And by using social media, I have been able to meet my patients where they are. So if that's on their lunch break or in the grocery store lineup, I've been able to offer them health promotion and education right where they are. And so now I'm not just able to get out from behind my counter, but I'm actually able to get out from behind my entire four walls. So don't be afraid to do something different, because it might just be the thing that changes your whole practice. So anyone who knows me knows that I really like to give some action tips. So if you are the pharmacist that really wants to start incorporating this, or the pharmacy owner, I'm going to give you 3 quick tips. Number 1 is to use your counseling room as much as possible. Don't save it for awkward conversations. Pull your patients in as much as you can, and that gives you an opportunity to have those conversations and make those connections. Number 2 is about offering solutions and connecting with other healthcare providers. Don't throw a ball back in someone else's court if you don't have some options and some solutions to go along with it. Open up your toolbox, come up with a plan, and then offer that. And you'll start to see that you can showcase what a pharmacist can do and the positive impact that a pharmacist can have on the practices of other healthcare providers. And then number 3, this one is super important. Start seeing your prescriptions as patients, not as pills. So today, when you check a bottle of rosuvastatin, don't look at it as rosuvastatin. Start looking at it as a patient who has dyslipidemia. Maybe go check their labs if you can and see how is that dose of rosuvastatin working for them. And then if you identify something, have a conversation with the patient. Are they having side effects from that? So, I'm really excited to share this concept with you. It is something that I've believed in for a very long time. And so if I've talked about something here today that has sparked your interest and you'd like to talk to me about how you can start building your own healthcare hub, by all means, you can send me an email. I'd love to chat with you on Zoom. If you'd just like to follow along with my practice, here are my social media handles you can follow along. Thank you very much for the opportunity.